Public health officials confirmed this week there are now community spread cases of COVID-19 in the St. George area. With that comes more potential restrictions by city officials. ABC4's Katie Crowless checked in with St. George Mayor John Pike and with the Southwest Utah Public Health Department. She brings us the very latest.
Now, officials with the Southwest Utah Public Health Department told us 2 weeks ago today that they were anticipating some community spread of COVID-19. So this news is not a surprise here in Washington County, but officials want to remind everyone that social distancing is not just a recommendation, it is critically important. Public health officials have reported 6 cases of COVID-19 in Washington County, with the 2 additional cases confirmed Wednesday appearing to be community spread, meaning person to person, with some not even sure how or where they contracted the virus.
Now it's just even more important that because of that we contain this and minimize the spread.
St. George Mayor John Pike says that while city officials in some areas of the country have brought in law enforcement to help enforce the CDC guidelines, he doesn't believe they're there yet as a community.
I think if restrictions were to go further, for example, a shelter-in-place kind of restriction, either at the county or the state level, I think what that means it's simply, to me, more of what we're already doing.
He says the St. George area is considered a sensitive region, with about 19% or more than 34,000 of Washington County's population considered elderly. A big portion of the community is considered high risk, not including the thousands estimated to also be immunocompromised.
Panic is not the solution in any situation, right? Being prepared is always in order, and that's what we're asking people to do.
Public health officials say testing for COVID-19 is becoming more available in southern Utah. And while up to this point, medical workers, the elderly, and those testing negative for the flu were being prioritized, now officials ask that anyone with COVID-19 symptoms, mainly shortness of breath, cough, and a fever, reach out to their healthcare provider for testing. In St. George, Katie Crowless, ABC4 News.
According to the Southwest Utah Public Health Department, community spread is now confirmed in Iron County as well. New